Good afternoon, and thank you for joining me today as we talk about COVID-19 pandemic here in Erie County. And I want to start today by expressing my heartfelt sympathies to the family, coworkers, and many friends of longtime sportscaster Gary Drapcho. He was a true Erie icon, and he will be remembered by sports enthusiasts and our community as a whole for his wit, his knowledge, and his big heart. Today, I want to report that we have 2 new confirmed positive cases of COVID-19 in Erie County, for a total of 42 positives and 1,157 negatives. We still have had no COVID-19 deaths of Erie County residents to report. Both of the new cases are in their 60s. One of them is tied to a known positive, and investigations are underway on the second case. The new cases are located in Zones 1 and Zone 3, which can be found on the cumulative case map by zone at eriecountypa.gov. As I said, contact tracing continues by the Erie County Department of Health, a tool that we know really works to try to mitigate the spread of COVID-19 in our community. I've been asked a lot about people in quarantine, and while I'd like to be able to share specific quarantine numbers with you, I truly cannot pull my staff away from the important tasks of the contact tracing and the other work they do every day to get you that exact number. But what I can tell you is we've had approximately 200 people who we have asked to be in quarantine, and they have complied since we began our contact tracing with our first case. Some of these individuals are now over their 14-day quarantine, and of course some of them are still in that period. I also want to share to you today the information regarding the gender of the cases that we currently have, and it is split basically down the middle at 50-50 in terms of women and men. Regarding race, the reason why this is such a challenge to report is we don't have control over the data that gets put into the system. This information comes from the lab samples, and right now, unfortunately, 30% of our cases are unknown in terms of race. And at the state level, that number in terms of percentage is almost 75%. What we do know, besides the 30% unknown, is that we have 21 white, 5 African American/Black, and 1 Asian. And that would be out of the 40 that I had talked about yesterday. The state numbers show positives at 26,490 today and 647 deaths. That is a 1,145 new case number and 63 new deaths in the past 24 hours within the Commonwealth. Warren County continues to stand at 1 case and Crawford County at 16. Allegheny County now has 904 cases with 26 deaths. As I look at all of the counties across the Commonwealth, we are the 38th in terms of cases, and as I've mentioned before, we are the 14th largest in terms of population. So we know that much of what we're doing here in Erie County is working and truly helping us to keep our numbers at a much lower level than so many other counties in the Commonwealth. So again, as I say every day, please follow all the instructions we have asked you to follow, starting with staying home unless you absolutely must go out, doing the personal hygiene that we have discussed, and keeping that physical distance from anyone when you are out. A lot of questions have been asked about outdoor activities that people can participate in. Going for walks or rides with people who live in your home is just fine, according to the state. Maintaining that 6-foot distance from anyone else that you might come in contact with while outside is obviously very, very important. And lastly, please wear a mask when you are outside, and wear that mask when you are out doing your walks, especially when you come in contact with anyone else. We have several guidance documents available at eriecountypa.gov on our COVID-19 page under Resources, under Community Health Interest. We continue to make updates on our website every day to try to make it easier for you to navigate and locate all of this very important information. But staying home and social or physically distancing and proper personal hygiene practices are the best things to do, and they are working here in Erie County. It's Wednesday, so I want to remind everyone that while you're at home, please complete the 2020 census. 2 weeks ago today was Census Day. So go to my2020census.gov to take your census survey today. Paper copies of the questionnaire are currently being sent out, and for those who have not responded yet online or by telephone, you will see one of these paper copies come to your mailbox very soon. As a reminder, these mailers are going to be addressed to resident at. It will not have your specific name on there, but it is your survey to fill out. The 2020 census response rates for this week are 54% for the entire county and 46% for the city portion of the county. So we still have a lot of work to do, and I ask you to please help us and fill out the census as soon as you can. Our environmental task force team received 33 new complaints and continues to make their field inspections to help our essential businesses stay open and be as compliant as possible. Once again, if you need information or guidance, go to eriecountypa.gov or always call us at 814-451-6700. Remember that this is National Public Safety Telecommunications Week, and that's your first responder, the person who answers that phone when you call 911. So if you would be willing to thank them this week for the great work they do, please do that by going to public.safety@eriecountypa.gov. And now I would like to talk a little bit more, or have some more information brought forward about the effects of COVID-19 from a mental health perspective. We've talked a little bit about this, but to bring in an expert, I have with me today Dr. Marianne Albaugh, who is the medical director at the Erie County Department of Human Services, Mental Health, Intellectual Disabilities, and she's going to share some very important information with everyone today. Dr. Albaugh?
Thank you very much, County Executive Dahlkemper, for this opportunity to talk a few minutes about mental health in this pandemic crisis. I initially want to express appreciation for these regular, consistent updates that you're leading to assist our community in a time of unsettledness. I want to thank everyone in our Erie community for their efforts to face this challenge in a united and integrated way. From the essential staff of healthcare workers, first responders, workers at essential goods and grocery stores, volunteers, and all the families and citizens of Erie community, we're all doing the part that needs to be done to manage exposure and flatten the curve, keeping each other safe as can be. My message today is really to hold on to hope. That is one of the core tenets of our work as physicians and as psychiatrists and therapists, that we hold on to hope for others in an extremely difficult time. You've heard a few weeks ago from the director of our Department of Human Services, John DiMatteo, regarding the systems that make up the Department of Human Services. That includes the Office of Children and Youth, Office of Drug and Alcohol, and the Offices of Mental Health and Intellectual Disabilities. So as the medical director with those teams, I'd like to just share an update about care delivery initially. There's been much work across systems of care to continue to provide active treatment at all levels of care, from outpatient services to partial hospital to inpatient, and then residential settings for the care of children, adolescents, adults, and families that care for them as well. Provider agencies across the community have been able to utilize telehealth resources that allow for phone contact when no other ability is available, and we want to keep people safe. We are also using video contact and then when necessary, there is an opportunity to see people in person so that the proper care can be delivered, as well as providing safety to support those who require the care and treatment. So really, it's about those that have been in treatment and continuing that at the present time, and for all those into the future in this uncertain time who may need a level of care. So please don't be hesitant to hold off on seeking out care. It's business as usual, and that should be the message in terms of accessing care and moving forward with care. We are providing mental health services and ongoing services for those with intellectual disabilities, those who need drug and alcohol treatment, those children and families who require early intervention services for their infant and toddler, and for those who are marginalized and homeless. Erie County Care Management continues to provide their case management resources at all levels. And most importantly, Office of Children and Youth continues to be quite active and continues to answer calls for concerns for child abuse and to support families. What I want to send next is a message that we do have this resource here in our community, and it's accessible. It's been a very difficult time for most families as they've faced this order to shelter in place for our community and by the state. And it's offered significant family time for everyone, but also significant isolation. In those challenges with family time, and they are many, it's navigating your family, your work schedules from home, perhaps for some a loss of work, fears of the illness. Those are just to name a few. And these are additional stressors that are added to the usual stressors that families and persons are experiencing. You are living with these very difficult situations, and within this environment, there's additionally, I talked about that hope earlier, to opportunities for strengthening the family time and family relationships. Education is occurring in the home now, and this too has a potential for a stressor, but also an opportunity for new interactions and new ways in which we support each other. It is important to reflect about courage in these times. This is occurring daily for all of you as each person and family faces these challenges. It's equally important to acknowledge when things have become overwhelming that it is most brave to ask for help and assistance. So again, my message is, please move forward with asking for help if you are feeling overwhelmed and in need. There are many resources that we can tap. Crisis services has been reviewed before, but I will share it again today for mental health emergencies, and that's 456-2014. Erie County Care Management Warm Line, which has been reviewed in the past, is available Monday through Friday from 8:30 to 5, and that number is 814-273-7007. The state has also introduced several weeks ago a Human Services Warm Line that's 24/7, and that number is 1-855-284-2494. As mentioned earlier, providers in our outpatient and community services can be called directly for assistance. So if you have a child in need or an adult in need of mental health services, you may call those resources that we have in the community that include Safe Harbor Behavioral Health, Stairways, Achievement Center, Sarah Reed, to name a few. There's more in that regard. And if you are having some questions about that, Erie County Care Management has administrative case managers that might be able to help direct you if you need that resource. They are also available to assist with linkages for intellectual disabilities and autism, and their number is 528-0600. You've heard about the homeless and housing resources number, and that's that you should call 814-SHELTER. And that number would be 814-743-5837. So 814-SHELTER. I want to highlight the importance of continuing to report child abuse if you are a mandated reporter, or if you are seeing it and understanding it in your family system or neighborhood, please call the Child Line. It is a 24-hour service. That number is 800-932-0313. It's really important that we protect our most vulnerable. Accessing drug and alcohol services would be to call 451-6877. Finally, I want to speak of community resilience. Judith Roden, who is a researcher in this area of resilience, describes a framework for community resilience. She describes 5 components in this framework that include awareness, diversity, integration, self-regulating, and adaptiveness. These are all key components for communities to work together and to solve problems and manage crises. I do believe that we have a strong community in this regard. I have seen much in the way of integrated care with hospitals working together, community resources working together to problem solve and to lay things out, and coordinating that with the Department of Health. These are keen times for that kind of work, and I think as we move through and keep hope, we will be able to be beyond this and be strengthened. I just have one more thing to say. I want to reiterate the importance of the county executive's message for social distancing, hand washing, the role of masks, and the ongoing efforts to shelter in place, even as we embrace the springtime, which I'm not sure when it's coming. There's still snowflakes today, but we will be challenged by that because we'll be wanting to be out and about. It will be very important to follow these rules until we can start to relax them. This is how our community can remain caretakers for each other and a resilient community. Thanks so much, Kathy.
Thank you so much, Dr. Alba, for being with us, and what a great message for our community. I just wanted to add one more thing that I thought of as I was listening, and that is that many businesses have an employee assistance program. So for those of you who are working from home or maybe just temporarily furloughed from your business, from the place of work, call back to your business and see if you need it, that they might have an employee assistance program that you can access for help if you're struggling through this time, as well as so many of the great resources that Dr. Alba mentioned. And many of those numbers, in fact, I think most of those numbers can be found at eriecountypa.gov under our COVID-19 resource page. And at this point, I'd like to open it up to the media for the questions for either myself or Dr. Alba. And I'm going to start today with Jet TV.
Yeah. Hi, Kathy. Thanks for releasing those breakdowns. We really appreciate that. But I want to jump into it. So I guess right now, what is the biggest issue Erie County is facing?
I think our biggest issue is people getting very antsy to get out of their house and to end this shelter-in-place, stay-at-home order and to get back to normal. And we all want to get there. I feel it myself personally. But what we cannot do is loosen up on this. We are seeing very, very good results from all of the great work that everyone has been doing of staying home, keeping their social distance, wearing their mask, washing their hands, all those things we've been saying. But I do fear that people are getting very tired of this, and they may start getting very complacent, especially, yesterday we had no cases to report. Today, now we have 2. And so people start thinking, well, maybe we're almost out of this, and start, as we say, taking the foot off the gas. We cannot do that. We have to keep on all of these restrictions to keep our numbers down till we find a way to navigate through this and open up our economy again. Erie Times News.
Hi, Kathy. It's David. The State Department of Health today started listing the number of cases by county at long-term care facilities, personal care facilities, and Erie County is listed as having 1 case at one of its nursing homes. One, do you know anything about this particular case, and how much of a concern is it to you that we do have a case at one of these facilities?
So I don't know much, but I do know that there was someone transferred to a very secure location and isolated from everyone else, but I'm not even sure of the location at this point. So I do know that we don't have any issues that are concerning to us in terms of the isolation of any individuals and being separated from others that they might live in more of a congregate care home with.
Do you, a quick follow-up question, do you know when this occurred? And then secondly, if you can, talk about your concerns about having cases at long-term care facilities like this, because we've seen in other communities around the nation where this spreads like wildfire.
Right. My understanding is this was more of a transfer to that type of a situation, but in some facility where they actually were ready for them. So, so we feel good about that, but we know any kind of our long-term care, our multiple residential care homes that we have in our community, and we have quite a few of them for our population. And we have a lot of group homes, of course, you know, with a lot of the work that's done, particularly on our intellectual disability side. So we have a number of those homes where people live together, and many of those people are more vulnerable. So it's certainly an area that we are very aware of what the risks are, and we work with all of our partners in the community to make sure they are doing everything they can to mitigate the spread into their residences. Erie News Now.
Hi, good afternoon, and thanks for the kind words about Gary. He was the absolute best. A question for you about masks. As we see Governor Cuomo urging, well, now requiring New Yorkers to wear masks, is that something you would consider, and do you think it would be a wise idea, A, for the state, and then B, for Erie County to require that people wear masks when they're out and about?
So I've been talking about masks now for a couple weeks since the recommendations changed on masks, and I think myself and so many others believe that getting almost everyone to wear masks is going to be the only way we're going to get our society back up and running in some sense of normalcy. We know that the person-to-person transfer is the most common way that this virus is passed. We know that 25% of people don't know they have it. So again, if you're wearing that mask and you're covering your nose and your face and you are a person who carries it and you don't know it, you'll be protecting those you come in contact with. So we are looking to implement in county government that in every county building, everyone wear a mask. And I've spoken with pretty much all of the elected officials. I think they have a couple left to speak with today, but they are all on board with this. So we are looking to implement this soon in county government and hopefully be the example to the rest of the community about what we need to do if we want to get back to being out more and being able to be part of our community in a way that we're used to.
Have you thought about issuing a county-wide mandate on that, requiring people to wear masks?
I think that that kind of an issue really needs to come from the state level. And what we would try to do, and what I've sort of been teeing up this week as I've talked about masks, is what we're hoping happens is that our businesses will see the value of this and will join us. And so if we're one of the first businesses to do this in our community, and we're not the first, because I know of a couple businesses that already have signs up. These are our life-sustaining businesses. They have signs up that say, no mask, no service. And so if we can get more businesses to buy into that, that will be the best way to do it, I think. And if we can get the community to understand the importance of wearing a mask and why they need to do it, and everybody understands that a mask now becomes part of your, I guess, fashion accessory. It becomes something that is the proper and, the community thing to do, then we will be much better off, even than we are right now. So we've got to get people to get past the fact that a mask looks weird, it might be a little uncomfortable, it's not normal, it's not what we're used to. We need to all get beyond that and understand that masks are going to become part of our normal, everyday sight in our community. And so how do we get there? We get there by one, everybody saying, yeah, you know what, this makes sense to me. I understand why we all need to wear masks. But in terms of a blanket order, I would see that coming from the state and not from the county government.
Thanks.
Talk Erie?
Yes, good afternoon. It's Joel here. I have a question for Dr. Albaugh. My question is, there's a narrative out there that the addicts cannot get to their AA or NA meetings. Is that an accurate situation? And could you elaborate on what's available for the 12-step people that are in 12-step?
It's an excellent question, and thank you for asking it. I would need to do a quick check-in with all of the providers to see how they are providing that currently. I know that there are platforms now that have been in use that allow for folks to join as a group, and various providers are beginning to implement those and utilize those. It does require a phone and access to the internet at times if for some of the technology, and again, those are some barriers for some folks in the community. So it's a work in progress. We might be able to get some more information for you after we do a quick current check on all the providers that have that. It has been a difficult component, and there's been different ways in which there's been outreach to those folks so that they do have the connection and monitoring and support that they need.
Quick follow-up. In your professional opinion, do you feel that the concerns of behavioral health were highly regarded at the state and national level when the stay-at-home isolation orders were being considered?
If I'm understanding your question correctly, you're wondering, was mental health considered as the various states and folks making decisions nationally to stay at home order, putting those orders in place?
Or even at the Pennsylvania level?
Was that considered? I think all of those things are considered, and in these difficult decision-making processes where you have people coming together and providing that information and discussion. It's not an easy call to say stay at home, but if you're talking about life and death and then looking at ways in which we can still be ramped up, and indeed the state did allow for expansion of telehealth services quite quickly to look at how we can support the community needs.
Thank you.
How about Jet TV? Do you have a question?
Yeah, Kathy, really fast, you mentioned there storefronts that have like no mask, no service. Where in the county have you seen that?
Somebody told me they have that at Pony Express over on West 8th Street. I don't know of other ones specifically, but I've heard of that one business for sure, and there may be others out there. So what we're looking at is, can more businesses do that? We need obviously people to make masks so that they would have a supply of masks to be able to do that, because we don't want people using the N95s or the surgical masks for those purposes. But even a bandana works, a scarf, anything that covers your nose and your mouth so that the water vapor coming out of your nose and your mouth does not reach anyone else.
Right, and then I've covered the story. I know the county had an effort moving forward with several organizations to kind of make an amount of masks. How is that project coming along? Do you have any updates on that?
I don't know the numbers, but it's coming along well, and we're actually working to try to maybe even see if we can't get some waivers for some businesses that are sewing businesses, and get more masks made for our community. If we really want to try to ramp up this mask use, we want to help people get a mask to be able to do that. So we have masks now in the hands of EMTA, so that when people get on the bus, they can get a mask. And we're going to have masks. The courthouse is not open, but we know that occasionally some people have to come in, and once we have this policy put in place that masks have to be worn in county government, we want to make sure that if anyone has to come in for a specific business at the courthouse, that if they don't have a mask, then we can have one for them there at the front entrance. So that's what we all need to be doing and encouraging people to do. And I've talked to a couple of business owners even in the last few days about this, and I've only heard buy-in from this. Everybody wants to get back to work. What do I need to do to have to get back to work and get my business up and going? And if we start seeing more masks being worn and less cases, we might have an opportunity to do that.
Really quick follow-up to that, just to clarify. So after the April 30th date, if that's when it is lifted, would the quote-unquote mask, I guess, restriction or carryover at the courthouse, would that still be implemented past April 30th?
Well, we don't know if the stay-at-home order is going to go beyond April 30th or not. That's what the governor, put in place, but we've also seen those extended in other places beyond April 30th. So we'll see if that date holds or not. And I know no one wants to hear that, but we'll see where things are at. In terms of the mask wearing, in my opinion, this is my opinion, believe that we will be seeing people wearing masks all summer long. We do not have a way to, we don't have a vaccine, and we have very little treatment options except to treat the symptoms of COVID-19, and we know how bad those symptoms can be for some individuals. So we don't have the testing also, that rapid testing and that very widespread testing that would help us find those 25% of the people who we know are positive and don't know it. I heard a story just yesterday about a family. It was in Ohio, but the mother, positive, very, very sick, 7 days in the hospital. The father, pretty sick, but didn't have to be hospitalized, stayed at home. The first son had a very bad headache, was taking lots of ibuprofen, never had a fever, but when tested was positive for COVID-19. And the fourth person, the second son, tested, never had any symptoms, positive for COVID-19. So that just goes to show that each one of us could react differently. So until we have a way of finding out, because those two sons in that family may have never been tested if their parents hadn't been positive and so sick. So that's what we have to find out. Who are those people that may be spreading it around our community? So until we know all of those things, I don't see us going out without masks on, whether we're in the county buildings or whether we're outside. At gatherings, the summer's coming up, everyone likes to go to all of our events. I'm not even sure how many of our events will actually occur because of this. So the social distancing is still going to need to happen, the 6-foot distance. How do we do that in the middle of some of the great events we have in our community? And those are all the things, those are going to be tough, tough decisions going forward, and probably not well liked by a lot of people if they don't happen. But what we have to do is try to find ways to keep people from spreading this virus and killing people and making people very, very ill. And so we're going to do whatever that takes to make that happen. But we also know that people want to get back to work and this economy wants to get back going. So what do we all need to do to be part of that solution? Erie Times News?
Yes, Kathy, just going back to the long-term care facility COVID-19 case, did you have a date on when that transfer took place?
No, I don't, David, and I'm not really sure where this person is currently, so we can try to find out some more information for you, but I don't know.
Okay, and then on the cases by race, and thanks for getting that information, 5 out of 27 cases are African Americans. That is, doing quick math here, I think double the population for the county for African Americans. I know it's a small sample. Is that a concern? It's a higher percentage?
It's 5 out of 40 that we know. We don't know about 30%.
Well, it could be, right. Well, it's 5 out of 20. You have 27 cases that you know the race,
right?
Correct?
And it's really not,
so it's 5 out of 20.
It's not really a sample that's large enough to really garner anything out of. And we don't have any hot spot. And I honestly don't even know, or maybe those people are related. We've talked about a couple of houses where there's a couple people in the house. I'm not even sure if these people are within that number. So we don't feel that we have enough data to make any kind of conclusion out of that. And we also know we have no deaths. And we've had very, very few people hospitalized. So when it comes to some of the big issues that we've talked about on race across the country, that's not happening here because we don't have many people that have gotten so sick that they've have to be hospitalized, and we certainly haven't had anyone sick enough that they haven't, that they've died. So we're going to watch it, though, and that's important. And so that's why it was really important yesterday when Secretary Levine said that these labs have got to put all the data into the system so that as a state, and then, of course, as a county, we can truly know what's going on. Erie News Now? Oh, did you have a follow-up to that, David?
Oh, no, just thanks.
Okay, Erie News Now?
Hi. Regarding eventually someday opening things back up, as we see governors squabbling a little bit with the president, and we have, of course, these Northeast governors kind of coming together and deciding that they'll make a move as one unit, and the president at times not necessarily agreeing with what they're saying. How do you base your decision? Is it something where you follow the president's lead? Do you follow the governor's lead? Do you make your own decision? Just curious about the decision-making process if you get mixed signals.
We're going to follow the lead of the governor. Public health really is under the purview of the states, and the states are, we're under the stay-at-home order statewide, and the business closures were done by the states, and so many of the things that we're living under currently was done by our state, our Commonwealth, and our governor's administration. So we will be following that. We're a huge country. We are very geographically diverse, and the situations will be different, I believe, in different parts of this country. So we will be following the lead of our State Department of Health and Governor Wolf's administration as we look forward to what we need to do to hopefully, eventually, soon, hopefully, rather than later, reopen our communities. Talk Erie?
Yes, hi. Question for you, Kathy. I'm wondering if there's guidance and or staff from the health department that are designated to these long-term care facilities. Again, that data point just popped up today on the state website, and we're just making sure that they know what their job is at these long-term facilities.
So these long-term care facilities, many of them are part of bigger networks, whether they're part of one of our local hospital networks or whether they're part of some other larger networks. And so they have a protocol that they follow according to their associations, their networks, their entities, similar to how the hospitals also do that. What we've been helping them with is what we call PPEs, personal protection equipment, and masks and things like that, gowns and things that we can help through our emergency management to make sure that they have the supplies that they need. But we are always there to assist and consult and help them figure this out if they need our help. But many of them have a whole layers of very knowledgeable people who have put protocol in place that these facilities need to follow. They don't fall under the county Department of Health. They actually fall under the State Department of Health, and then of course some of them, as I said, are part of much larger systems. But we're willing to help them in anything they need.
Do you know if there's any enforcement going on from the state level as far as ensuring protection? And there's bad actors in every industry.
I don't really know the details on what's happening on those levels, but I can assure you any nursing home that I have seen, heard from, have knowledge of in our community is working day and night to try to keep any COVID-19 from entering their building. It would be devastating for that facility, obviously for the people that live there, who they care for every single day, and no one would want that. So I believe that they are working diligently to mitigate that. It's been a long time since many of us have seen our parents and grandparents and others living there, maybe even our spouse, who is in a nursing home. And so that is obviously very difficult, going back to the mental health issues. And actually, as a teaser for Friday, we are going to have Dr. Lynn from LECOM's gerontology here, and he's going to talk a little bit more on the mental health issues from that side of things, from the gerontology side, and particularly so many people that are in these long-term care facilities and unable to be connected to their families in the way they're used to. Jet TV, do you have any questions left?
Yeah, just one more question. So I had a couple first responders reach out to me, and they were still questioning, I guess, the health department's regulations or rules when it came to listing the COVID-19 cases. They were kind of just really pressing to want to know why more hasn't been released, like specifically names.
So we have the addresses all in our 911 system. We actually did that before much of the state did. And now the State Department of Health is releasing the addresses to all the counties. So again, because we have a health department here, we are ahead of the curve on that. And any first responder who's going to a residence in our community where there is a COVID-19 positive case will be aware of that when they go in. The biggest risk for our first responders is those 25% of people we don't know, or the people who are contagious but haven't yet been tested. Those are the people that everyone should be most concerned about, including our first responders. So that is really where the transfer is happening, not only for all of us, but for our first responders across this nation. And so we tell everyone, don't be complacent just because you're going and this person has not been identified as a COVID positive. Don't be complacent. Use protective masks at a minimum when you approach anyone within 6 feet. And I would say as a law enforcement, it might be even farther than that, depending on what kind of situation you're in. So there's a lot that is out there in terms of guidance for our first responders, and we're talking law enforcement, fire, ambulance attendants, EMTs. So we are looking at this every day, and we believe that we have really done a good job of making those addresses known. Again, we have, as I said yesterday, 17 who fully recovered, and so that left us, now we have 42. So, every day we're going down in the numbers of people, but we're actually keeping those addresses active for 30 days so that, there might be somebody else in the home who was quarantined and now maybe feeling some symptoms. So we felt it was really prudent that not only when they recovered, we don't take them off when they recover, we wait the full 30 days after that house was tagged before we take that address out of our system. So we care deeply about our first responders, and we are following the state's current guidelines, which now they are doing with the rest of the counties across the Commonwealth. But we kind of led that here too. Erie Times News, do you have any last questions?
Yeah, Kathy, one quick one. You mentioned 17 people have recovered. That's the same number as yesterday. There hasn't been any more recoveries since yesterday?
Yes, and we don't expect that we'll have new recoveries every single day because, of course, we didn't have cases every day, and people recover it, sometimes in 5 days, sometimes in 10 days. It really varies on the person. But as we have more recoveries, I will bring those numbers to you.
Okay. And then you had talked a lot yesterday about the beginning of discussions with state officials and within county itself as far as emerging from this. Have there been many talks with state officials in the last 24 hours, either you or members of your staff? Is there anything new to report in terms of possible timetables or anything of getting out of the stay-at-home order?
There have been no new discussions, and really our discussions are more internal right now. We're waiting for guidance from the state, but I think the state is also, as we said, looking at a kind of a regional approach with those other states. And I think even within the Commonwealth, they'll be looking, I believe, at things in a regional way. As we know, in the Northwest here, our numbers are much lower than in the Southeast. And so they hopefully will look at all of that as we look at, how do we bring businesses back up? And remember, all those businesses were ordered closed by the state. And so we have been doing the enforcement of that, but it will be up to the state to relax those, and we've not had discussions on that at this point yet. Erie News Now, do you have any final questions?
Just one. You said that one of these people here was tied to a known positive. Are they in the same residence, or is it someone who just had recent contact with a recent positive?
Yeah, they are not in the same residence, so they had a contact with a known positive.
Thanks.
Mm-hmm. And Talk Erie, do you have any final questions?
No, thank you, ma'am.
Okay, well, thank you again for joining us. I thank Dr. Albaugh for joining us today. Great information. We all know that this is a very stressful time, even for the healthiest of us and those who struggle with mental illness, substance abuse, and other behavioral problems. We know that they need even more understanding from us, more compassion from us, and we hope that we can reach out. If you know somebody who's living alone, if you know somebody who's struggled in the past, please reach out to them, offer your support Tell them about these numbers that are available for them. Tell them to visit our website. And if they don't have a computer, get them those numbers off of your computer. And let's make sure we're looking out for each other. So in the meantime, please stay home, please stay safe, and please stay calm.